Okay, we'll just wait for your classmates to join in. Okay, good afternoon.
Definitely.
Okay, so today we will focus on public health, the economics and financial aspect of it. Like it or not, um, our healthcare system would be involved in costing. Okay, so for the healthcare system to run, we have to have money involved, and that is the truth of the matter. Okay, so you have to have an adept healthcare system such that when you have a situation such as the coronavirus, you are able to mute, please. I will mute you. Okay, and withstand the problems of coronavirus. As you will have remembered, top five countries, Italy is considered as having one of the best health systems in the world by the WHO. But what happened? Because of the pandemic, their health system was overwhelmed such that they were unable to cope with the coronavirus public health wise. And that goes for any other country in this situation. Very few health systems survive unscathed um, in this world, in this global pandemic. Okay? So, what you have to learn is that um, health services should be both private and both government. So most of it, the best health systems would have a combined private and public health coverage, meaning the government will spend on your health, but you will also have a part to spend for your health. Why would you think that model will work better than, for example, the government will spend all the money for your health and no out of pocket from the citizen? Why do you think that would be the best case scenario? Wouldn't it be better for the government to just spend 100% for the health of one individual, rather than I spend 50%, you spend 50%, or I spend 80%, you shell out 20%? Why do you think would that scenario be the best case scenario? What are the possible reasons? Anyone? Anyone? Could you care to answer? Why do you think? As far as resources are concerned, why do you think the government sharing the responsibility, not 100%, is the best case scenario? Anyone? Prajuwal Kumar, why do you think? Or for example, using this analogy, some There were two
To
businessmen.
the
Yes.
social due to the social economical status difference, we can't cover the everyone's one. Like government can focus on the people below the poverty lines.
So why would you ask that to spend that ask that person to spend if she has no money? The government has more money. Why would a purely public expenditure not be an ideal scenario? Do you get my point? The government has money. She has the choice to provide everything for the citizen. For example, in North Korea, that's the case. But what's the problem with that paradigm? What do you think?
Private hospitalization.
Private hospitals? Number one, your resources are limited. For example, can India provide healthcare for a billion Indians? So your resources are limited, hence the government would be limited in capacity in providing health for all. So it is sharing. Another reason would be what? For example, there were two businessmen. One inherited the business from his or her parents. One built it from scratch. Who do you think would give importance to his or her own business? His or her business more?
The second one.
The second one. Same way with health. If 100% is provided by the government, ah, who and you will the other one, you will share expenses in building your health. Who will who will take care of his or her own health better? Also, the second one, correct?
That's one.
Do you get my point? Such that you are a stakeholder and you have a benefit from it. Thereby, you are also expected to put some effort into it. And that is why the 50 or the percentage private and government paradigm works best. That is how they explained it. Okay? I will not go through the slides one by one. I will emphasize points not emphasized in the video that I ask you to view. Otherwise, I would just ask you to view the PowerPoints again. Okay? If you have any questions at one point, please do um, raise raise a question. Okay? So we have the elements of your health system. And all health systems aim to improve health status of our citizens and have the following um, sectors. Where is that? Okay. Leadership and governance, health information systems, major part of it is health financing, human resources for health, essential medical products and technology, and service delivery. So a well-functioning health system should have these characteristics. Okay? Of course, one would have to have good leadership and governance. If there is none, your health system will crumble. A very good information dissemination system. So, for example, the ones that you mentioned, before you place a call, they will say COVID, blah, 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 blah. That's one way. Health financing, of course, in any system and in any organization, your funding is very important. Of course, important resource would be the manpower. Essential products. For example, that would be the vaccine that should have that were developed in the pipeline, fast tracked, and how we deliver these services. So it is from top to bottom until it reaches the stakeholders that will benefit from health most. Okay? So the following slides are the characteristics of each. I have read that in your video, and you will see that, for example, during this pandemic, most of these were affected. Supply chain, medical products, for example, pricing. What happened to disposable masks? From 50 pesos, it became 1 4 because of scarcity, which we will go back later. So you have to have these policies in place such that it won't be abused, etc., and will continue service for your health system. Okay? So these are targets. Of course, in any health system, you have your targets. So most common example would be your Millennium Development Goals, and essentially your Sustainable Development Goals, which was discussed you in a prior lecture. Okay. Okay. So definition of terms. So health economics. So the issue of lockdown is very much in argument because of the repercussions a lockdown would have on an economy. So no country was spared. Most of the countries were in one way or another in a form of lockdown, although our country has the longest lockdown in the during this pandemic. So what is important would be balancing and understanding how your health would affect the economy. Okay? So these are economic terms. So know your gross national product and your gross domestic product defined by the following. Okay. So how would these affect health? So per capita, that is your problem. That's why your health services could not be ranked, because per capita you would really be with China as far as the number of population would be concerned. Okay? So know the concept of inflation. So that's the erosion in the purchasing power of money. So this would be the definition of health economics. So apply theories and concepts to economics as far as healthcare is concerned. So for example, during the coronavirus pandemic, what are the examples of the challenges that it will place on a government as far as health economics would be concerned? What are the examples that you could think of? What are the challenges as far as health economics is concerned? Oops, I'm sorry. What are the challenges? Anyone?
Doctor,
Yes.
first is the quantity of resources based on the ratio of the population. Second is organization and funding. And the third is the efficiency of the health workers.
What's the first one?
First one is the number of resources available for the ratio of population.
the number of resources available to be dispensed to the population.
Yes.
The second one is
The second one is organization and funding. So, how are we going to receive these resources? And the third one is the efficiency of health workers.
okay. What are the examples that you could think of? So that is in theory. Okay. So using the coronavirus pandemic as an example, what are the challenges for the government or any individual with regards to health economics? And it's a problem of all countries, facing all countries right now.
The budget system, doctor.
The budget. So what
Yeah.
would the people do with regards to budget? The
They would
government.
have to negotiate and come to a conclusion of
Do
how
they
much
have
we can compensate and increase in the health sector and avoid certain unnecessary or comparatively low prioritized
so you
activity.
see the priority now is to get people, as many people vaccinated in the shortest period of time. Correct? So before the development of vaccine, a lot of dollars were put into that. Okay? And health economics surely played a role in the development of a vaccine fast tracked. Okay. Now that the vaccine is available, how will you deliver this service? So all countries are clamoring for providing funds so that they could procure the vaccines for their own citizens. Okay. Fairly simple, not that simple. So for example, as I've mentioned, as you have seen in this video, most governments, particularly the Philippines, would have to budget on. They would have to have a budget on infrastructure, on education, etc., etc., etc. Such that in normal circumstances, what? The budget of health is usually around 4, 5, 10%, etc., etc., depending on the country. Now, health is getting the bulk of it because the urgent need is for the health and vaccination programs. So they are rechanneling their other budget to your health. Or the other way around would be what? To get a loan from the World Bank. So most governments now are loaning left and right to the World Bank or to China, hopefully not China, etc. So in short, they should produce the funding so that they could vaccinate. What are the other avenues? The government raises taxes. For example, here it's sin tax. So if it's a vice like alcohol or cigarettes, it's more expensive because to deter the people from buying cigarettes, they increase the price. So all of that is part of economics and an interplay of everything. But for example, how will you raise taxes when there would be a lot of people with no jobs? Hence, it will be a vicious cycle, and this is what I've shown in this slide. You could start anywhere, but at the end, it's a depleted workforce primarily because your population is not healthy. And if you live in poverty, which we also define the poverty of food threshold and your poverty threshold, it's a vicious cycle. You would not have the ability to work. You would not have income, no access to food and services, therefore more disease and therefore the more you cannot work. Okay? Such that it's important to take note that a healthy population would almost inevitably lead to a better economy. Maybe not always, but an unhealthy population will not lead to a better economy, and that is for sure. Okay? So these are your expenditure. You see, the Philippines is ranked among countries that we haven't even heard of mostly. All right. Okay. So health economics, cost of disease. Who has who has been sick in the Philippines? If you got sick in the Philippines while studying here, you will definitely ask for more money from India. Correct? And I know a lot of you are telling me that medicines are very expensive here. That's why most of you bring your medicines from India because prices of medicines here are quite high. Okay? Okay. So returns from investment in medical education, training, and research. And this is where you balance it. Private education, of course, your parents spent money for you to be a doctor. Okay? Same way with here in the Philippines. To train and research, and it's not just money. You devote time, you devote hard work, etc., etc. And of course, that would be an investment for you. Come when you are a doctor, you choose it to have a living. Although most would say, "Oh, I became a doctor because I want to help," etc., etc. Truth of the fact is, you have to be realistic and that you need to provide for your own family and put food on the table. So, of course, medical cost would also come from that. So, that's the health economics of it. And if it's expensive or and if it's difficult to become a doctor, of course, that could not happen, right? You cannot have a population without the doctor community. So what will the government do then to entice people to go into the medical field? So may offer scholarships, they may offer programs, etc., etc., so that the cycle would not be broken. So for example, now, given the pandemic, almost every other course stopped except for your medical profession and your allied health services. So we have to continue your education because we cannot stop producing doctors because eventually if we stop, there might be a great void in between wherein there are no newly graduate doctors and that will pose a problem eventually. Okay? So these are terms. Just look at it. So minimize cost. You look at the cost benefit ratio, how cost effective and how cost utility. So for example, whenever you receive your allowances, I'm sure you would have applied this in one form or another in one point of your lives. Cost minimization, lowest opportunity cost for a given activity. So for example, you are budgeting for food and you are minimizing cost. So instead of eating in KFC or McDonald's or Domino's, you will eat at where? At times in one of the carinderias or the canteens there. Cost minimization. Okay? So those are examples of daily life that you use this. Okay? Cost effectiveness. So intervention or anything that you procure. So what would be more cost effective? For example, primary or tertiary prevention as far as intervention is concerned. You know that when treatment, for example, diabetes, what would be treatment for diabetes? What would be the cost? As to having a diet and limiting sugar intake in the first place compared to taking medicines daily or injecting insulin daily. Okay? Okay. So this is your ACER and ICER. So your healthcare cost over clinical outcome. So what does this simply tell you? It is comparing outcome A to outcome B for your ICER. So to know that if this additional cost would be significantly different. So for example, your incremental cost, for example, drug A or drug B. Okay. Your statins, your simvastatin, for example, is the cheapest drug. So it is drug A. The newer ones, for example, rosuvastatin is your treatment B. So if you will compare the ICER as far as average cost is concerned, so it would cost another $30 per additional treatment for drug B compared to drug A. So, and then you as a doctor, would I prescribe the newer drug or would I prescribe simvastatin, which more or less have the same effect of lowering cholesterol? Same way with pain reliever, would I continue prescribing mefenamic acid compared to other drugs that are more expensive but could address pain better? Something like that. Okay? But you all know, going back to this, especially in the medical field, not all would be dependent on cost. Okay? There are a lot of different variables, the human factor, as far as being a doctor is concerned, that money cannot, um, money could equivalent be affected. Okay? And those are your intangibles.
8 कील और 800 कील कुछ ना 800 डैमेज कुछ नहीं है बोला है
Again, what's your comment? Okay. So here's scarcity. We've mentioned this a while ago. So of course, when it's scarce, you have to provide for the marginalized and those who will not be able to provide for themselves. So this happened um, when the masks were in demand, basic goods were in demand, the grocery shelves were all out of products, out of alcohol, etc., etc., and the likes. So, especially in a pandemic, health needs are endless, but health resources are not. So remember that. such that the demand increased such that it will um, vastly affect how our health economics will play. So, for example, demand increased because of the pandemic, but other sources of increase in demand would be the consumer would have a lot of disposable income. Okay, depends on the taste and preferences of consumers. But now it's back to the basics. I have to provide the basic needs for my family. And you could imagine the poverty line. 5,000 basic needs, 8,000 basic food plus other non-food basic needs. And what happens? Earning 9,000 per day, that barely leaves a family of 5 for non-food needs. Much more for unexpected expenses such as health expenditure. So you have your food and poverty threshold. Of course, you have to do your budget and allocations. Okay. So in summary, this would be health financing. So sources, as I've mentioned, government, private source, etc., etc. Major problems, of course, it's still funds, unequal distribution, rising health costs, lack of coordination, and waste. Okay, so this would be the out of pocket wherein you pay for your own health. Each would have disadvantage and disadvantage. So this would be insurance. It would also have its advantage and disadvantage, and your health cards. Okay, so these are frameworks that we use to maximize resources and maximize utilization such that our health would be properly be taken care of. So summary of issues, insufficient public spending on health as mentioned, reductions in public financing, increased out of pocket, so no financial protection, particularly for the poor, so low efficiency in allocation and lack of reliable data information. And of course, we have a lot of problems, especially with this pandemic. Okay, the latter slides are PhilHealth. Just read through it. Um, I'm sure your national insurance program would be similar in form as well. Okay, any questions? Your public health in India, if there are any corrections that you would like, you are more knowledgeable of that on me. That is just based on research. So if you want to raise something that is not correct,
Hello, doctor.
yes,
Dr. James.
yes,
So
James.
why is it that you guys have the longest quarantine than any other country in Asia and around the world?
Are you in the Philippines?
Yes.
Why do you think people
Is it
students
based on
in the Philippines?
the people who make the decision, or is there a very valid reason why?
Are we really in a lockdown? If I will ask you, in the truest sense of the word, lockdown.
Somehow it's still yes. You want me to explain why?
Why?
Okay, like India, people are going back to physical classes. And there's a part about this lockdown I still can understand. It beat my imagination that we are medical students and we are also stopped from going to physical classes. If we are to be frontliners tomorrow, shouldn't we know the technical know-how, how to coordinate ourselves and help other people? But we are also the team by sitting home. So to me, it's still kind of locked down because the activity is still slow.
Still lockdown, yes, but are people really not going out? I don't think so. If they would really enforce a lockdown, they should have enforced it last year, March, April, June, etc. But they opened it for reasons, as I've mentioned, you have to balance between your health and economy. Okay? Last year, the priority was health because anyone who had the coronavirus had a very high chance of dying because we didn't know the virus yet. We don't know how to treat, etc., etc. Come 1 year after, you are beginning to think of other sectors as well, primarily the economic sector, wherein it cannot bear a longer shutdown because the economy, as I've mentioned, the GNP, the GDP would be greatly affected and it would be all downhill from there. As actually it is going downhill. The economy, well, at least for the Philippines, I could say. I don't know for India. But the fact that we have to open up businesses because if we prolong this, more businesses would be closing and that the Philippines cannot bear because it would further push people into recession, the nation into recession, and we would not want that to happen. But the problem is the coronavirus cases are increasing. It's either because it's just now that we are testing more people or there is really an increase or a surge in cases. For example, the lockdown would be lifted. Would you be confident to go out?
Yes.
Yes. Problem is, for example, vaccine. They are rolling out the vaccine. What is the problem? Very low utilization of people actually wanting to receive the vaccine. And that's very sad. I just talked to our barangay health worker in our village. Barely could they reach 50 people who are willing to get vaccinated. And there and thereby the way people view public health, there lies the problem. And that is why you will see most doctors posting that they got vaccinated. Is it just something that they want to post out of the blue? And it's a way for us, short of proclaiming that go out, if you have the chance to get vaccinated, go out and get that vaccine for yourself. Because again, if you go back to the basics of preventive medicine and public health, you have to have that herd immunity. And herd immunity could only be achieved through vaccination. And even if it's one of the expensive forms, because that would cost, government is moving hell and high water to get that vaccine for us. But the problem is what it is procured, now people don't want to get vaccinated. So why the lockdown is
People
still in
don't want to
place?
get vaccinated because some people complain for different reasons. Like a some people say there's an like experiencing blood clotting and all those things. So with fearful news, nobody want to put themselves at risk because like nobody know exactly if it's compatible with this person or not that person. We don't even know because the normal lifetime for vaccine isn't what happened. So this vaccine was made in hurry. So obviously you want to take precaution. So I won't blame them either way.
But again, you have to give that informed consent. Yes, it's a risk. For example, I took the vaccine despite knowing knowing of the risk. I am a diabetic, hypertensive, I am asthmatic, I have a lot of allergies. So name every risk factor in that box, I check it. Yet I still got the vaccination because, again, we go back to the bioethical principles of informed choice. Getting the vaccine, did I know that I can get an anaphylactic reaction because I have allergies? Yes. Did I know that if I am immunosuppressed, I could get the coronavirus vaccine, worst case scenario, blood clot, etc., etc.? Yes. And a lot of journals and a lot of case reports will tell that. Uh, I will not tell the brand, but there was a doctor vaccinated, ended up in the ICU for 4 days because of anaphylactic shock. But out of that one, I am not saying that just because it's one, it is not significant. But out of that one, other 30,000 doctors and healthcare workers were vaccinated for the past month or so. And that is still significant regardless if it's not so high or regardless if there's one who had an adverse reaction. Again, going back, why is there a lockdown in my opinion? Still a lockdown in my opinion. The lockdown was not enforced properly. If you remember right, if last year they gave 5 days for the people in NCR before they imposed a lockdown. Okay. And what did that I don't know, not 5 days, 2 days. And what did the 2 days do? It allowed some people to go home to their provinces, which further propagated the spread of the coronavirus in the Philippines. Okay? And other more administrative decisions that were a failure. Okay? And if we will talk about your question, why is still Philippines still in a lockdown, and we could take all day for all the reasons that we could think of. Okay? You will see people not wearing the masks properly. You will see people wearing face shields, but they are wearing it like a visor. You will see reports of negative PCR tests. So they don't care if they spread the disease as long as they are not the ones who have severe disease by holding that fake PCR paper. Okay, so it's not only a health system problem, well, it's deeply rooted as well in the culture of the people in that particular health system. So again, if you do lockdown, at what cost? The Philippines is primarily a tourism country. So it's really the opportunity cost, especially now it's approaching summer, is vastly high. And why are we in lockdown today? Next week will be Holy Week. People again would be clamoring to go out. So again, if you will not have an essential reason to go out, please do stay at home. Because like it or not, Perpetual is full. Our COVID wards are full. So we simply cannot accommodate more patients than what we already have. And the only way to curtail that is again to limit movement in one way or another. Okay? I hope I answered your question, James. Any other
It's
reaction?
okay.
Any other reaction? When you go back, and or even if you don't go back, look at your country and see how they have responded to the pandemic. And yours would be harder. Remember, you have
Life is normal now, Mama.
life is normal. Oh,
Life is normal now.
I wish all for all. You see, you have a billion people, although it's I think it's still one of the higher number of cases. But now at least there's vaccine, more or less you know how to treat, etc., etc. And that's what matters. Not like last year, wherein if you get the virus, you don't know how to treat and people die from it. Now it's less. The severe ones are less, but still we have to limit the number of people who will eventually get the virus, okay, for obvious reasons. You want to go back to class already?
Yes.
And it's hard. I'm sure it's hard for you. It's hard for us as well, your teachers. And especially hard for your clerks and interns who are supposed to be rotating in the hospital. Okay? For example, I am, well, it's community medicine. So how in the hell will I teach community medicine if I cannot bring you to my community, to the community of our school? Okay, so those are things that we have to balance before we even ask you to go back. Okay? Any question? That sound out. Any question? Okay, so if there's none, you may leave this call. Thank you. We will not have an exam yet because we cannot give exam yet for the March batch because most of you aren't enrolled. Um, so the lectures will just move up. Anyway, I will tell Munish what would be the activity um, for for that particular day. All right. So, but unless I will explicitly say we will not follow the scheduled exam that I think I placed in your schedule until further notice. So most likely I will just combine long exam 1 and long exam 2. If I am allowed to give the exam already by the time long exam 2 is scheduled. Okay? So if you don't have questions, you may leave this call. Thank you. Good afternoon.